Well, as a major pharmaceutical company, by the very business that we do in producing innovative vaccines and medicines for people, we're improving health of everybody around the world just by the business that we do. But in addition to that, because we think that's not enough, GSK has chosen to make a contribution in Africa, which is far more wide-ranging. And it encompasses 4 key areas, really. Doing the research and development for African diseases in the first place. There's still not enough R&D done on many of the diseases which disproportionately affect Africa and the developing world generally. So GSK is committed to work in that area, both treatments and vaccines. Making the results of that research and development as affordable through widespread, preferential and not-for-profit pricing, which is how we operate with all our antiretrovirals and all of our antimalarials in Africa. Then working in community projects where the company has a long legacy of working with communities in Africa to help them to deal with issues like stigma and discrimination associated with HIV/AIDS, to learn about basic hygiene facilities. And there are 4 disease areas we focus on. HIV/AIDS through our Positive Action Programme, malaria through our African Malaria Partnership, lymphatic filariasis, where we're a founder member of the Global Alliance to eliminate that terribly disfiguring disease, and in basic hygiene and sanitation, where we have a number of school-based programs which show children not that they should wash their hands after going to the toilet, but why they need to do that. Well, it's a mixture of things. In the R&D side, we do a lot of the R&D ourselves, but for the more neglected diseases, we work very much in partnership with academia, with the London and Liverpool schools in the UK environment, with the UK government, and with public-private partnerships like the Medicines for Malaria Venture and the Global Alliance for TB Drug Development, because they have created a sustainable model for doing research for these diseases for which there is no market, and therefore it would be quite hard to justify commercially to work in these disease areas. So in R&D we work in partnership. In preferential pricing we also work in partnership, not only with NGOs and healthcare providers in Africa, but also through making our products more affordable through voluntary licensing of our antiretrovirals. So we've granted to date 8 voluntary licenses to African companies for our leading antiretrovirals. And in the community investment area, we work very closely in partnership with a wide range of non-governmental organisations and multilateral agencies, and have done for a very long time. The company has had the necessary leadership to enable us to do that. Our CEO, JP Garnier, when he took over as head of the company when GlaxoSmithKline was formed, said he didn't want to be the chief executive of a company which only provided medicines to the wealthiest 20% of the world's population. So he has made access to medicines one of his core drivers and one of his key objectives. And that has enabled us, those of us within the organisation who work in this area, to really drive those policies down in a way that makes our products as accessible as possible. But traditionally, Africa represents probably less than 1% of the global pharmaceutical market and has consequently had very little attention. I think a prerequisite to enable our contribution to have any impact at all is to have functioning healthcare systems. And that isn't something which is in the gift of the pharmaceutical industry. We work in partnership with governments and NGOs to help provide healthcare, but fundamentally the investment in healthcare infrastructure to enable people to access any sort of healthcare services and thereby the medicines that we provide has to be the responsibility of governments. So that means additional resources from the G8 and other leading developed world governments. They need to deliver on the promises from Gleneagles, but it also means ensuring that developing world governments prioritise healthcare in their national budgets. That isn't always the case. We have seen the right sort of leadership in countries like Uganda and Botswana who are investing in healthcare, who have faced up to HIV/AIDS, who are breaking down barriers around stigma and discrimination, and there we've seen real improvements in healthcare. But in many parts of Africa, you're as likely to be stoned to death if you're found out to be HIV positive as you are to receive treatment. And that sort of basic lack of healthcare provision, lack of education, lack of knowledge, and terrible stigma and discrimination needs to be addressed before what we want to do can be really maximised. Absolutely. I think unless there is political will at the highest level that is driven down throughout countries and governments and local government structures, then we're not going to see any real progress. There's a number of initiatives going on which hold out some sense of hope. They're very, very wide-ranging. You mentioned the mosquito. There is work on a genetically modified mosquito which doesn't pass on the malarial parasite, which is more fertile than normal mosquitoes, and so if introduced could eventually take over, and we could see a decline in malaria that way. Likewise, the WHO has now started to support the use or the limited use of DDT to control mosquitoes with indoor residual spraying and wider use. There are issues there around contamination of the food chain, etc. But I think the risk-benefit equation is now moving in favour of that. But there are also much simpler technological interventions that can be used, such as bed nets. Bed nets have become, insecticide-treated bed nets are long-lasting. They've become very cheap to manufacture. They can be provided free of charge or at a very low fee, and sometimes it's better to charge a fee because when there's no cost there's no value, and if people have paid a little bit towards it they value them more. But if more people slept under bed nets, that could make a huge difference to malaria, and probably less than 5% of children in Africa sleep under a bed net. And then there are new innovations coming through on the biomedical side as well. The GSK has a malaria vaccine which has been proven to halve the likely death rate from malaria. It's not going to eradicate the disease, but it's going to have a huge impact on the morbidity and mortality of the disease, and we hope to have that available in 2010. And there are new treatments coming through. The new artemisinin combination therapies are getting more widely available and are dropping in price as well. So there's a whole range of interventions which can help with malaria. And likewise on HIV/AIDS, as more resources have gone in, those countries that have shown the sort of political leadership that I mentioned earlier, we've started to see a decline in prevalence and a decline in death rates from HIV/AIDS. So there is some light at the end of the tunnel. A lot more also needs to be done on TB. We haven't had any new TB drugs for some time. There's a lot in the pipeline now, but there's nothing on the short horizon. So there's still a lot has been achieved, but there's a lot more still to do. Well, you have to be optimistic, because if you're not optimistic, you'd give up. So I am optimistic that it's going to improve. I think there are signs that it is improving, but it's not an overnight answer. It will take a long time to make up for the lack of investment in healthcare over many, many years in most parts of Africa. So we are beginning to see improvements in that area. That needs to be maintained, and funding organisations like the Global Fund need to be properly resourced as well. So we've seen improvements. That needs to be accelerated if we're going to achieve the Millennium Development Goals. So I do remain optimistic, but I call on governments to deliver. The reason why we're engaged in these issues is because we think it's the right thing to do for patients and because it's the right thing to do for our business. And that's a very powerful and compelling mix of imperatives, which means that what we do is sustainable and we're going to continue doing it for the long term.